2020 was quite the year, the emotion that it evoked and all the things that happened, and wondering would we ever get back to close to where we had been before. Hi, I'm Dr. Terri Richardson. I'm an internal medicine physician during my day job, but I also do a lot of volunteer work out in the community. During the pandemic, it was quite a change in my life and the life of the healthcare system in general. We were seeing some incredibly sick people. I was concerned about a lot of the patients that I talked to on the phone. I was listening to them, using every sense that I could because I wasn't seeing them in person. And I always get a lot of energy when I'm seeing patients in person. I can just feel things. It makes me think broader. I can help them better. But, this was a different time. Once the numbers were there, we saw across the nation, Black and brown people were being infected, affected, and dying from COVID-19. It just really exposed some of the inequities that we have in all of our systems, including the healthcare system. I learned about this one bus driver in Detroit. Someone came on his bus coughing. He became ill. He had symptoms. He tried to go in and access the healthcare system, and he was just kind of sent home. You're not sick enough. He was an overweight man, a Black man. It was just pure D racism. Here he was serving the community, trying to help, and he can't get the help that he needs. And it really shouldn't be that way. Healthcare is a right, and everyone should be treated appropriately. Medical people sometimes say, hey, we're here to take care of people, to make them healthy. But we're all people, we're all human beings, and we all have a lot of biases. It will take Black people 228 years to close the wealth gap. Why is that? Because we had years, decades of free labor for this country. It is not recognized. We got nothing but poverty, poor health. A lot is owed. Can it ever be repaid? Free medical care, and not just substandard medical care, but getting all of your medical needs met, from prevention to acute care, emergency care. That would pay some of what is owed to Black people. In the midst of COVID-19, here we have this racism that occurred when a Black man had a police knee to his neck. It's like you already were like an open, festering wound from the COVID, and then that happened. I actually started blogging. I said, let me try to get out some of my emotion with, writing about what happened with George Floyd, writing about the intersection of these two terrible pandemics. I started doodling a lot. I've always been a doodler over my lifetime. Somehow that had a calming effect for me. I needed to calm myself down. I'm a person who always said, never let them see you sweat. With all the things that happen in your life and going through medical school and college and all that, said people will never know what I'm really feeling, because if they do, they can hurt me. That takes a lot to try to keep up that facade that everything is always okay and you're never gonna see me sweat. And so I was getting to the point, it's like, I'm gonna have to let some of this stuff out, because I really will go under, and then I will not really be able to help the patients because I'm gonna be out of here. Started doing more self-care. Instead of really spending all my lunch hour eating or thinking about what I was going to do, I said, let me get some sun. I'll stand up and move my body around and get the blood flowing. And so I started coming back out, but I think it mostly was the sun, just like the sun, and appreciating like the birds and feeling the warmth on my skin. It helped me to come back, and I thought I've got to build in these natural breaks. Every time I go to the grocery store now, I buy myself a bouquet and I put it up and I look at it and say, I'm happy to be alive, and these flowers are beautiful.